Menopause sounds terrifying to many women, not only because of hot flashes and sleep problems, but because menopause is often associated with aging. It feels like the moment when we are no longer young. And yes, menopause is a natural part of aging. But it does not mean that we have to lose our strength, health, beauty, energy, or confidence. In this video, I want to share why I personally started hormone replacement therapy at 44, what symptoms I had and what actually changed for me. And of course, this is my personal experience, not medical advice. Always speak to your GP or menopause specialist about your own situation. All women go through menopause, and if we think about it, a very big part of our adult life is spent after menopause. So the question is not, can I avoid menopause? The question is, how can I support my body through this transition and protect my health for the next 30, 40, or even 50 years? Lifestyle is absolutely essential. Strength training, enough protein, good sleep, walking, stress management. All of this matters enormously. But some changes happen independently of lifestyle. And one of the biggest changes is the decline in sex hormones. We're talking mainly about estrogen and progesterone. Estrogen is extremely important for many tissues in female body. Bones, skin, vaginal area, the brain, mood, sleep, and overall well-being. Progesterone also plays an important role, particularly for relaxation and sleep. So when these hormones start fluctuating and decline, many women feel like something is off. I started HRT in December 2024 when I was 44. At that time, I still had periods, but they were becoming irregular. I didn't have severe hot flashes. I was still training. I was still disciplined. From the outside, everything probably looked fine. But inside, I didn't feel like myself. My sleep became worse. I often felt tired but wired, exhausted but unable to relax properly. I also had a noticeable drop in energy and life drive. I could still follow my routine because I'm quite disciplined, but I didn't feel ambitious, motivated, or unstoppable inside. And one of the most uncomfortable symptoms for me was vaginal discomfort. It felt almost like non-stop thrush infection. I would treat it, it would improve, and then it would come back for no obvious reason. Many women have different symptoms. For some, it's hot flashes or night sweats. For others, it's anxiety, joint pain, headache, repeated cystitis, itchy skin, itchy ears, poor sleep, or just a strange feeling that they are no longer themselves. That was exactly how I felt. Not terribly ill, not broken, but not fully myself. So I decided not to wait. A lot of women wait until symptoms become unbearable. And I understand why. We're used to carrying on. We work, take care of families, support everyone else, and very often we ignore our own symptoms. But I didn't want to wait until I was completely exhausted. I knew that perimenopause can start years before periods stop completely. So I decided to speak to a medical professional and consider HRT while I was in perimenopause. For me, it was not about trying to be 20 again. It was about protecting my health, improving my quality of life, and having enough energy to keep doing the things that actually support long-term health. So what I personally use? First of all, you need to understand that my HRT is personalized to me, my symptoms, and my medical history. I use estrogen patches rather than tablets because patches are often preferred for women who want to avoid some risks associated with oral estrogen. I also use vaginal estrogen pessaries twice a week, which help me massively with vaginal discomfort. For progesterone, I have a Mirena coil, which protects the womb lining. And because sleep was one of my main issues, I also use micronized progesterone at night. This is what works for me personally. It doesn't mean this is the right protocol for every woman. Some women need cyclical progesterone, some need a different dose, Some may eventually consider testosterone, some may not need HRT at all. This is why it's so important to speak to a qualified practitioner. So what actually changed for me after I started HRT? First, my energy came back. Not in a fake stimulated way, more like I could finally access myself again. My sleep improved, I felt more rested, more stable and more capable. The vaginal discomfort disappeared as if it had never been there. But the biggest change was this. HRT gave me the capacity to do the lifestyle work. Because this is the truth. HRT will not train for you. It will not build muscle for you. It will not cook healthy meals for you. It will not make you walk, lift weights, manage stress, or prioritize protein. But when your hormones are supported properly, you may finally have enough energy to do those things consistently. And this is where the real transformation happens. So, is HRT absolutely necessary for every woman? Probably not. But menopause is unavoidable for every woman. And we have a choice. We can simply accept every change as natural aging, or we can ask questions, speak to our GP, and learn what options modern medicine and lifestyle can offer us. With or without HRT, after 40, we need sustainable routines to protect our bones, muscles, metabolism, mental clarity, and confidence. If you are over 40 and you don't feel like yourself anymore, don't ignore it. Start paying attention. And if you need help building realistic routines around training, nutrition, lifestyle after 40, send me a message.